All right. Hi, everyone. I'm going to start us off talking a little bit about the Career Center. So we were quite busy this summer. We have a lot of changes that had happened. One of the big changes I was just telling the folks here is that we changed our name. So some of you might be looking at our name and not really recognizing. Oh, thanks. Thanks, Allison. You might not be really recognizing that many differences. But what happened is we actually dropped a P and we added a C. So we are now the Career Center for Counseling and Psychological Services. And I'll talk a little bit more about that psychiatric services drop here in a minute. But you can see that we don't offer psychiatry services. Our psychiatrists are now with Healthy Minds University. And so I'm going to go through all of our changes in full detail about everything that we had worked on this summer. All right, so we're still in the same location. That hasn't changed. So we're in the Health and Education building. We're on the top floor. One of the big things that has changed is our website. So if you haven't gotten a chance to look at our website, please do so. We had a complete overhaul of it this summer, and we're still continuing to make updates to it about all of our services. So we had gotten a lot of feedback about just too much information everywhere. It was kind of hard to find things. And so we have things quite a bit more organized and kind of detailed out what our services are, what all of our services mean. And then we also have online scheduling on our website, which is really exciting. And we'll talk a little bit more about that later. But I think the online scheduling piece can be really helpful. I was just over in Allison's office and she was meeting with a student. And I was like, hey, Allison, we have online scheduling. You're trying to schedule an appointment for a student. And so you can just do that online if you're meeting with somebody. And do it, if you're having a virtual advising meeting, you can have them pull up that website and the student has to go in and fill it out because they have to be credentialed and use their mixed email accounts. We still have our 24/7 line. So students can call 293-4431 at any point in time during the day to have an urgent crisis clinic appointment, to schedule an appointment, to ask questions, or our after hours line. They can use that service Monday through Friday, anytime after 5 o'clock and on the weekends. And then we also have our crisis text line available as well. So a lot of times we get questions about who works at the counseling center. So I wanted to make sure I put this in here because it can get really confusing. So we have about 28 full-time staff members. And so some of our staff are licensed social workers, some are licensed counselors, some are psychologists, some are in the process of getting licensed. And then we also have trainees. And so we have master's level trainees who we supervise, and we have doctoral level trainees as well who are completing their pre-doctoral internship. So if you're ever working with a student and they mention to you that they're seeing another student, yes, that 100% happens. We have 6 trainees this semester, and like I said, 3 of the pre-doctoral interns. And so a little bit about our services. I'm going to go through again, like I mentioned, in detail about everything that we do at the center. I want to make sure that you all know what services we offer so that way you can communicate it to your students when you're meeting with them. So this was a big change this summer. We have our urgent crisis clinic. So our urgent crisis clinic is Monday through Friday from, I know it says 9 to 5, it's 8:30 to 5 on there. And so this is for a student who's experiencing an urgent need or a crisis situation. And so if they feel like that they need to come in and talk to a counselor immediately, they can do so with an appointment. And so they can physically walk into the center. We're still having a lot of students call in, but we're asking the students who call in to come into the center and meet with one of our clinicians. And so a big change from last year, because we were doing mostly telehealth services, we've transitioned everything to in-person, especially for crises and emergency situations. And so our groups have kind of gotten revamped. We have, I think, far more groups than we ever have before. The information about our groups are on our website, but they run weekly, all semester long. Students actually have to be triaged for our groups. So they have to come in for initial appointments, and then the counselor will talk with them about whether or not a group makes sense for them. And those are more process oriented. So they're different from the workshops that we offer, because our workshops, students actually don't need to come to the center first. If they're experiencing anxiety or they want to learn some mindfulness skills and they want to join one of those 2 workshops, they can do so just by going to our website and contacting the group leader or signing up through like the sign up link on our website. And so for those, it's either a 3-week or a 4-week commitment, depending upon what workshop they're doing. And those are more psychoeducational and more so focused on skill building. So this is the piece that I think everybody gets confused about. I think students get confused about it. I think staff, faculty get confused about it. And so you're probably like, why the heck is there a picture of a traffic jam and a roundabout? Because I'm going to explain it, and it makes a lot of sense. So we offer short-term counseling. I would say almost all university counseling centers offer short-term counseling. It's really brief and goal-oriented. So what happens if we didn't offer short-term counseling? Say we saw every student that came into the center, right? Then what's going to happen is we're going to look like this. We're going to have people who are trying to come in for services, but we have no appointments to put them in, right? I mentioned we have 28 staff members, we have 6 trainees, and then 3 predoctoral interns. So they're going to fill up probably within the first couple of weeks. I think we've probably already seen close to 700-800 students already this semester. And so could you imagine if we like only saw the first, couple hundred students that came into the center, we would not be able to service everyone. And so our goal is to get folks in, and just like a roundabout does, to get them into the direction of what they need. And so not everybody could benefit from short-term counseling. Sometimes students can benefit from long-term counseling. Sometimes students can benefit from group or a workshop or another program that we might offer. And so when students come in, we want to try to figure out, okay, what direction do they need to go in? And so with our short-term counseling, it gets confusing because more than 60% of our students are coming in with prior counseling experience. So they want what they had when they were in high school or whenever they were in middle school. And so their expectations are a little bit different than what we're able to offer because we have to service so many folks. And so that's why I know sometimes a lot of students can be frustrated that they come into the center and then we're trying to help them get connected to somebody else. And so I think it's important to kind of understand why we have that model and how our goal is to get students where they need to be so we can continue serving the entire student body. And then one of the things we're doing, I put on there telehealth versus in-person. So we are doing in-person services. We're having all students come in for that initial triage appointment in person, the intake in person, and then our clinicians are working with them whether or not telehealth is appropriate. And so we have to kind of determine, we have criteria that we have to go by to determine whether or not somebody is eligible for telehealth services. And when they are, we're able to offer that to them. And so you might hear students say, I meet with somebody in person or I meet with somebody telehealth. It just kind of depends. So you all probably have heard about Talkspace, maybe have read about it on e-news or gotten an email about it and somewhere else, or one of the newsletters that had gone out. So we worked on this contract pretty much all summer long with this company. And so what we wanted to do is we wanted to provide students an opportunity to meet with a therapist regardless of wherever they're located. So we know we have students that didn't return to campus. And what happens for us as clinicians, we can only meet with students if they're in the state of West Virginia. And so when students go home for break, if they go to Pennsylvania, Virginia, like wherever, we're not able to meet with them because of licensing laws. And so Talkspace gives an opportunity for students to meet with a therapist no matter where they are. And so it's a really great option too for a lot of our undergraduate or graduate students that have really busy schedules and that want weekend appointments or kind of like later evening appointments that we might not have available anymore. And so they're able to do that flexible scheduling. And then all WVU students have access to Talkspace. And so every student will have 2 30-minute appointments per month. If they want more, they would have to pay for more, but every WVU student has access to this. I think we've gotten about 300 students registered for Talkspace already this year, which is a lot. So the care management piece goes a little bit with what I was kind of talking about earlier with our short-term model. And so we have a staff of care managers who work with our staff to train them, and they'll also meet with students to help connect them to providers in the community. We see a lot of students who are coming in that need more specialized care. We have students who have pretty significant, eating disorders, and we want to get them to an eating disorder specialist. Or we might have a student with more significant trauma, and we want to get them to a trauma specialist. And so our care managers will work with students depending upon what their needs are to get them connected to a provider that meets that kind of criteria. And this is the piece I think, again, sometimes students can be frustrated because, they want their free services, right? They want free counseling, but our short-term model doesn't necessarily always match everyone's presenting concerns. And so that's often what we're having to talk with students about and having to work through because it may not be clinically appropriate for them. And so the other piece is our student assistance program. So this is more for students who received an alcohol or drug related infraction, and they are mandated or required to come in through the Office of Student Conduct or Residence Life or the magistrate, whatever it may be. Our SAP folks also meet with students who come in for self-referrals, and they recognize that they have substance use concerns. And so they're wanting to maybe decrease their use, then they'll meet with our SAP folks. Outreach, we've kind of changed our outreach also this year. One of the things that we're offering is a series called Let's Chat. And so we offer it Mondays 2 to 3 online via Zoom, and then Tuesdays 3 to 5 in the Blackwater room. And so what we do is we have counselors available during these times for any student across the university to either walk in or hop in on Zoom to ask questions. So they are not made a client of the Carew Center. We don't collect any information. We're there to reduce barriers to care. And so a lot of students gave us feedback and they were like, I don't necessarily want counseling, but I need help with something, right? I need a little bit of problem solving, or I'm struggling with my roommate and I'm not sure, how to manage or navigate this. And so this is what Let's Chat is really used for. And so students can meet with one of our clinicians for 15, 20 minutes or so and do a little bit of problem solving. And then we also have wellness workshops where we're partnering with Adventure that are coming up in October, one in November. All of the information about outreaches are on our website as well as Refresh. So if you're working with a student and you're trying to get them connected and trying to maybe help them meet other students, that Refresh website can be a really good resource to connect students to others as well as our programs that we're offering. All right, so this is probably the biggest change that we have navigated and managed this summer. And so we used to have psychiatry at the Carew Center. And so as many of you can remember, our psychiatry services were not free, right? Students were billed for our psychiatry services. And so we transitioned our psychiatry still in the same building, but they are no longer with Carew and they are with WVU Medicine. And so with that, we're able to have more psychiatrists and able to have more students seen. And so they're just on the floor below us, on the same floor as WVU. And this is for students who are needing psychiatry services or to students who are needing longer term care. And so we're able to get students connected to Healthy Minds University therapists directly by working through with their care managers. And so this has been absolutely instrumental with making sure that students are receiving the best possible care so they can have their psychiatry and long-term therapy all just in that one location. And what they're able to do too is we have several students hospitalized every week on inpatient units. And so they're able to directly discharge our students into care at Healthy Minds University. So that way they have a psychiatrist and a therapist upon discharge. And so that was one of the biggest changes. And so if you have a student who needs to meet with a psychiatrist or says that they have a provider from back home, that they want to transition up here, Healthy Minds University would be that referral. And so the 304-598-4214 is that contact info for them. All right, so we wanted to put in here too information about Potomac State and WVU Tech. So actually their clinicians just came up to our campus on Friday. And so we were able to meet with them. And so I wanted to make sure that you all had their contact information available. And so if you have any questions about, if you are on Potomac State's campus or Tech's campus, you know how to contact your therapist on that campus as well. Okay, so a little bit of data. I know I kind of shouted off some numbers earlier, but I wanted to share with you all kind of what we've been seeing. And I think I actually worked on this presentation, I don't know, 2 weeks ago. So this is a little bit old, but the numbers really haven't changed too drastically. So about 50% of our students reported this semester that that COVID has negatively impacted their mental health in the following areas. So students are reporting more loneliness and isolation, poor memory and poor attention, difficulty connecting with others, loss of motivation or focus, academic issues, and avoiding anxiety-provoking situations. And so when I ran this report, I was surprised, but then again, I wasn't at the same time. I think I was surprised that the numbers were well over 50% for these areas, that the student is kind of checking all of this on their intake paperwork. But also, if you think about, what's happening with COVID and the pandemic, again, not surprised, right? And so our students are really struggling, and they're communicating that to us. And I think they're communicating that to you all as well. And so we're seeing, as always, we're seeing more freshmen than we normally do. We're actually have been seeing more graduate students than we had in the past as well. So that number is like a little bit higher than it has been. I already mentioned this, that 60% of our students reported previous therapy. So this means that students are coming in having had therapy in middle school and high school. And so this is a more normalized thing that they're experiencing, and they're coming in having had that prior connection, which is why we're seeing more students having a need for longer term care. This number was kind of shocking and how high it was. So 87% of our students reported anxiety-related symptoms. And that's pretty high. So normally I would say it's around like 60-some%. And so for it to jump up 80% is pretty significant. Anxiety and depression have always been like the top two pieces on why students come to the center. So for them to be high wasn't necessarily that surprising, but to be that high was. And so our numbers haven't necessarily changed with suicidality and what students are reporting. And so that's pretty typical where it has been in the past. That 29% of our students reported thoughts of suicide within, I think it was like the last 2 weeks of them coming in to the center. And then 8% of our students reported previous attempts. So we are seeing more and more students with more kind of chronic and ongoing needs, which again is why we created Healthy Minds University and why that was worked on for several years, and to why we're able to get Talkspace and working on like Let's Chat and some of the other pieces that we had navigated this past summer. So I'm gonna let Allison take over and talk about my favorite meme.
We love this meme.
Everyone's favorite.
Right, when you ask people how they're doing, sometimes they say this is fine, but their house is burning down. We all do it, I think, for sure. And certainly that probably happens in advising appointments. So we really rely on advisors to let us know what's going on with students. You're often the first person they talk to or come to when they have a problem. You get to know the students, you get to know their baselines, you get to know when things are off. You have regular check-ins with them, and it's very easy for you to do additional check-ins if that's appropriate and what's going on. I know that you all are very, very busy certain times of year, so it is as you're able to do it. You may also have students tell you that they're having a lot of adjustment issues from going online to back in person. Even though a lot of students said that they wanted to be in person, some of them are experiencing that anxiety and having difficulty getting back on a schedule and getting prepared to go to classes. And so they're having a lot of difficulty adjusting, even though it's something that they indicated they previously desired. But we really rely on you all to use your rapport, use your knowledge of that student, and have these conversations with students. You're often going to be the first person to see something going on. And so there's just some help that we think that you all can do. One, to demonstrate you care and help them get some of those supports that they need, maybe even just reinforcing some self-care practices that they might be neglecting, helping them find the balance. And these proactive conversations really help, get the ball rolling. Of course, we have the care team, we have Caruth for the support resources, but I think that there's a lot that you all can do just with your relationships and the interactions you have with students. So we're going to talk a little bit more about proactive conversations.
So I would add on to the, so what I always talk about with this meme is a lot of times we see our students when the house is on fire, whenever they're in extreme distress, right? They're coming into our urgent crisis clinic. They're emailing you all at 3 o'clock in the morning, telling you I'm not okay, or right, all these different things. And so I think we can be proactive and help students recognize, before the fire gets started, that when they start smelling smoke. And so we can have conversations with them about like, okay, wait a minute, you're struggling now. Let's talk about what we can do to help you manage things instead of waiting until the house is completely on fire.
Absolutely. So part of these proactive conversations, and this is all within, some skill sets that either you have or you can develop and work on. So the first question is, what have you done before that's been helpful? Sometimes students are encountering problems for the first time in college that they haven't encountered before, but they might have dealt with something similar in the past. So helping them brainstorm and problem solve. So what are things that have helped you in the past when you felt a lack of motivation to get classwork done? What have you done before when you're uncomfortable talking to instructors? Oh, an email? Can we write an email here together? Connecting to resources absolutely is something that's not always in your job description, but absolutely something you do almost every day, I'm sure, with students. Knowing those resources and being able to identify what might be helpful for a student and referring them to those units with accurate information. And then a big thing is being aware of your own boundaries. So that would be within working outside of your comfort zone and your skill set. So one thing that I like to say, when you want to look at boundaries, if you feel like you are the only person in all of WU that can help a person, that is a good indicator you want to check your boundaries, right? If you feel like you're the only person that can problem solve for the student, that you're the only person they can go to for help, that might be an indicator that you're overextended and outside of your boundaries. So take a look sometimes how often you're communicating with students, what that communication looks like. Are you relying on the appropriate people and the resources? So say, for example, if you refer a student to counseling, but they keep coming back to you to talk because you're just so lovely and easy to talk to, right? They're going to keep using you instead of going to meet a counselor. And so then you're going to come to a point where you're getting really overextended and uncomfortable. So it's really important to check your boundaries, not because we don't think you can do it. We know you can, but we know your plates are also full. And so we want to make sure that you're directing people to the right places and making sure that you're not the only person that can help them, because there are a lot of resources here on campus. So here's some other examples of how you can help. For students that are reporting a lack of academic motivation, reminding them why they're here. What is the insight? What is the goal? What are we here to do? Sometimes I have conversations with students older in their junior or senior year. We want to get you out of here, right? Don't you want to go do that thing? You want to go to this grad program? You want to go work on this job? How can we get you there? Setting small daily goals. Change is really hard, or else there would be a million changes we'd all make in our lives right now and everything would be great. Change is hard. So nothing happens in one big swoop. Setting those small, achievable, small goals can help someone lead to bigger change. And so they can also get a sense of confidence as they're going through that. Pairing work with some fun, rewarding yourself, making things less difficult to do. Yes, you're going to have to study, but can we make you comfortable when you study? Can you light your favorite candle? Can you have your favorite snack? Can you put your feet in a foot bath while you read? Anything to help kind of pamper yourself while you're doing it can make things a little bit more easier to get through sometimes. Creating routine and habit. This is a big one we're seeing a lot of right now. People are totally disrupted, with their schedules. And so just trying to create with this hybrid world and like not always having to show up, but sometimes having to, it can be really disorientating. So how can we create structure for a student to kind of abide by a schedule? People really strive for routine. So how can we create those instances of routine in their life? And then reminding everyone to breathe, right? It's a marathon, it's not a sprint. I think through COVID, we've learned that, right? We're not on lockdown for 2 weeks. It's been a year and a half, right? So we all need to breathe through it and just remind ourselves that there's a little bit we can do each day and to be kind to ourselves if some days are a little bit more productive than others. For students that are feeling overwhelmed, you can ask them, when's the last time you took a moment for yourself? One time I asked a student, what do you like to do for fun? And they're like, I can't remember last time I did something for myself. I can't remember last time I did something just for fun. People are just really exhausted. And also, setting realistic goals can be really important. Yes, I'm behind on this, but you know what? I'm going to read 5 chapters tonight and I'm going to write 3 papers tonight and tomorrow everything's going to be fine. That's not really realistic, right? Or thinking that you're going to catch up with a large amount of work, or that someone might, impart grace upon you and then everything's going to be okay. So we need to be prepared for what's achievable and make sure our expectations are aligned with that. Are they taking on too much? A lot of times we try to overload our plate. Especially in a time of stress like this during the pandemic, we might be overextending ourselves to others and not taking care of ourselves. We sometimes also can be our worst enemy and have really negative self-talk, be really critical on ourselves. Time management and organization, I think, is always something that can be looked at and improved on even into adulthood. So please don't underestimate that option. Like I said, routine and balance is really, really important in getting through this. So one other resource, the success coaches are great. They can help people be accountable and make sure they're using their time efficiently, like reading comprehension, for example, making sure that they're using their time efficiently. So that's a great resource if you haven't already used it. So referring to Caruth, right? So sometimes we're like, okay, there's this thing, I'm trying to help the student and I know I'm not the best person, but like, how do I get them to go there? I don't want to say like, you could use some counseling. Like that's kind of awkward. So how can we do that in a way that's safe and supportive? So first and foremost, you're having this conversation because you care and you want to help them, right? If you didn't care, you wouldn't have this conversation. So remember, that's where you're coming from. And so what we're trying to do is get support for the student. Sometimes though, we want to dance around it a little bit and say like, hey, is everything okay? And a student says, yeah. And then you're like, oh, well then now how do I say you should go to counseling because I've noticed these things, right? So you want to make sure that you're also being very direct and specific about why you're talking to a person. What have you noticed? Has something been different from their baseline? What is piquing your interest of thinking that this person could use some extra support? Normalizing mental health care is so important too. If I fell down right now and sprained my ankle, someone would come to me and say, oh my gosh, are you okay? Should we get you to student health? Do you need crutches? Do you want some pain medicine? No one would say like, why don't you hobble on it for a few weeks and see if it feels better magically? Like no one would ever say that. So we need to make sure that we're treating our mental health just as importantly as we are treating our physical health and taking the time to mend and support and seek the appropriate care for those things. Seeking help is a sign of courage. It's a good use of resources. Students are worth it, right? You're worth it to spend time on yourself. And the most important thing is to provide accurate information about Caruth and those services, right? So if you're trying to build a bridge and say, you should go to Caruth, they're absolutely going to see you. You can be there all 4 years. You can see them like every week. It's totally fine. And then a student goes there and that's not what Caruth does. Then they're going to stop going. And so that not only hurts their chances of getting connected to that support resource that they really could use, it also might damage your relationship and your trust with that student. So it's really important that we are providing accurate information and so that we can, let students know what to expect. A lot of times people are like, okay, so these things come through email. And then now I'm like, oh, how do I craft this response? It's so, I'm not sure what to say. So here's an example that we're providing. You absolutely don't need to take it, but it might be just a suggestion to show how easy it is. So first you want to say like, hey, I acknowledge what you share with me is difficult. I'm so sorry you're going through this hard time. I want to make sure that you get the help you need. And that might not be me. That might not be me as the best person. But let me tell you some people that are going to be able to help you. And that would be either the care team or the Caruth Center. You want to give a little example of what that unit can do. Usually they're coming to you also for another reason. So you're going to have to address that. Like, yeah, we can talk about your classes, once you feel a little more grounded, or we can figure out a plan on that end. And just providing that accurate information. And I think we're back over to Morgan.
I think with COVID, one of the things that we've been seeing, and like Allison and Freddie can attest to this, with the care reports that have been coming in, is just so much communication via email from students saying that I'm not okay, right? Them telling you that I've been struggling with my mental health, and I'm not sure if I can like finish this semester. I need to take time off, or I missed this test. I don't know what to do, or I think I'm going to fail this class. Students are really kind of outwardly communicating that they're not okay, and they're really communicating their kind of mental health challenges. And so I think some of these emails are really great examples about like how you can respond to students to be supportive while also connecting them with services, whether that's the care team or connecting them to us at the Caruth Center. And so I just wanted to talk a little bit about just some of the signs of distress, right? So how do we know when a student is really not okay? So, whenever we have, I think we can all kind of identify that we experience stress. Like I can totally raise my hand really high on that one. But thinking about, okay, so when does like stress become distress, right? I was just talking about this the other day with a student because they were really struggling with functioning and, all these different things. And they thought that they were just kind of stressed out. And I'm like, well, you have been managing this for, like 5 months and living with like all this heavy stress. So then you're kind of like over here in kind of like the red zone, right? Kind of going downhill steady and fast. And, that whole house is on fire thing. So they sat for, months, right? Sipping on the coffee while the house is on fire type of thing. So these are just examples of different signs of distress. So students can, report these things, or these are things that you can notice, in conversation with them, right? I think some of the carelessness pieces is a lot of times students might be like talking about this, with somebody else, or maybe they mention to you, that they're doing this. Like maybe they mentioned to you that, they go like for a drive on the weekends and they're driving on 79, like 100 miles an hour, right? They just don't care. They don't care anymore, right? That they're so overwhelmed that they're just going for this drive, right? Red flag, right? That's a sign that, okay, wait a minute, why is somebody doing that? Like what's going on with this person that they're doing this, and that they're identifying that, this is how they manage, right? Or cope, right? Not healthy. Alcohol and substance use, if you're meeting with students in person, of course, you can always smell this. But also asking students too, like, how often are you going out? Like you said, you're struggling with time management. What are you doing, with your time? Like, how are you spending your time? Like asking questions like that can give you more details. Of course, students are not necessarily always going to be forthcoming. So this is a piece you may not necessarily notice as much, as an advisor, unless they share that information with you. Now, back to anxiety, right? So this is the one, and when I'm talking about, like we all experience anxiety, right? Anxiety can be motivating, but this is the more extreme anxiety where it's kind of debilitating, where the student is not necessarily able to function because they're so completely and utterly overwhelmed with whatever might be happening. And so maybe it's an exam that's coming up, or, maybe they're sharing something with you, and in the back of your mind, you're like, okay, that doesn't seem like that big of a deal, but then you see them visibly shaking and like tearful and just, verbalizing that they're extremely terrified or worried about, getting a B in this class, or, whatever it might be. And so this is kind of the more extreme end of anxiety that we're dealing with. We're seeing a lot more students kind of report like kind of going back to this, that they like feel like that they're going to pass out or die, right? That they are like maybe sitting in class or like walking to class, and they have this like physiological kind of response to, worry about academics, and they feel like that they're going to pass out. We've had quite a few students who go to the emergency room for this. What's going to happen with the emergency room is they'll be discharged like back to us. And so like communicating with students and can get a better understanding about what it is that they're so overwhelmed with. I think our students are definitely putting a lot of pressure on themselves, right? And we're experiencing external pressures from other places, family, or, whatever it may be. And so they're getting to that point, like I think a little bit quicker, and they have these expectations that may not necessarily always be realistic. And so feeling like that they're not able to meet them kind of sends that anxiety meter kind of over and above, where that's some of those physiological kind of responses come from. We talk about distraction. Again, we're talking about, really students' inability to recall details from a conversation. And so maybe like you're having an advising appointment with them, and, you ask them to summarize like the plan, and they're not able to summarize it, right? They're not able to kind of recall that information, or there's like some sort of memory loss or lapse, right? Then we know that, okay, that student is disconnected. Like they were physically there, maybe meeting with you, but not necessarily mentally. So it's like, okay, what's going on, right? The student is not okay. Poor contact with reality. This one is something that is pretty observable, especially if you have been meeting with a student and you notice their changes over time. Allison was talking about, like, you guys as advisors are main points of contact. And so oftentimes you get to see that baseline for students for the most part, and then you get to see kind of any changes that happens depending upon how frequently you're communicating with them or how frequently you see them. And so this is, a student who is maybe not necessarily communicating in a way that really makes a lot of sense. They're telling you that, maybe that they are the president, or maybe they're telling you, just something kind of off the wall and unusual, and you're kind of like, wait a minute, and they're fully convinced that they are right and that you're wrong. And so this is kind of more of a sign of poor contact with reality. And then, of course, suicidal and homicidal ideation. And so students are reporting, if they report to you feeling helpless or hopeless, or feeling like everything is out of control or unmanageable, or they just don't know if they can do it anymore. A lot of times students too are communicating through like social media or through emails, right? We've had several students email faculty saying that they're concerned that their mental health is going to deteriorate, where they might attempt suicide again because they had in the past. And so just being kind of cautious of what students are communicating. And again, Allison and I were talking about, like, you guys are advisors, right? You're not a counselor, you're not a therapist, you're not trained on how to look at an email and kind of identify what it is that might be going on with the student. And that's where we can really help you navigate these pieces. And so one of the things that we do ask, though, is that you ask students. So if you are concerned that a student might not be okay, ask them, are you having thoughts of suicide? Are you thinking about ending your life? And being really direct about it, because when you're direct, that doesn't mean that the student is going to, end their life, right? It just means that you're directly asking them, are you having these thoughts? And so, they're able to answer you yes or no. And it's really important to ask about suicide versus harm, because if you ask about if you're thinking about harming yourself, I think I seen a care report not long ago where they were talking about like a student, was concerned about harming themselves. That means something completely different, right? And so somebody could be experiencing thoughts of suicide, right? Maybe with an intention or plan to end their life. And you ask about harm, they're going to tell you no, because harm means, like their own kind of physical injury. So maybe it's like cutting, burning, scratching, something like that. So it's important to be really direct when you ask that question. And so if you are concerned that a student is suicidal and you're not sure what to do, please give us a call when you're with that student. And so maybe if it's a Zoom appointment or they're there in your office, call us with the student. And so you can say something like, I really appreciate you sharing that with me. I know it might feel uncomfortable or unusual that your advisor is asking you these questions, but I'm also worried about you and I want to make sure that you're okay. And I appreciate you giving me that information. Would it be okay that we call the career center together? I think it could be helpful for you to talk to a counselor right now, and then see if they're able to call the career center while they're on Zoom. You can have them call on their phone, or if they're there in your office, you guys can call together. The reason why I stress to do that when they're there in your office is because what happens is if they leave your office or that appointment ends, right? And then you call me at Caruth and you say, hey, Morgan, I just met with the student. They're telling me that they're having thoughts of suicide. I'm not quite sure what to do. I'm going to be like, okay, well, where is the student, right? And we're not going to be able to find them. So sometimes what happens is we have to send university police looking for them, which is so invasive. And so we want to try to get them connected in that moment. And so if the student's like, what, I'm not really interested in talking to somebody, trying to get them to and say, like, I understand that, like, it can be really weird to talk to a counselor, and like, no, I respect that you might be uncomfortable, but I'm also worried about you. I want to make sure that you're safe. I'm concerned that you might end your life, right? And so trying to get them to be able to talk to us. And then you can always say, well, can I call them whenever you're here in the room with me, and then let them know what it is that's going on, and then we can kind of take over from there. Now, when we talk about like a life-threatening situation, and so this is if a student like ingested medication, or if the student had cut themselves like deep enough where they need medical attention. And so this is a situation where you want to call 911. And so if a student tells you that they, took, X number of Tylenol, or they drank, NyQuil or whatever it may be, or, that they're even intoxicated or under the influence, this is a situation where you always, always, always call 911. And then they'll receive medical attention. And so that would be the most important piece. So this piece is what Allison had created through the care team. I'll let her kind of go over and talk about this.
So like we said earlier, there are a ton of resources on campus. That's amazing. Sometimes it's hard to understand who we're calling when, right? It's almost like Ghostbusters. Who are you going to call? So we have a couple charts here just maybe to help give you some guidelines about where we're going and why. These are just categories that I've made up this, but it helps me compartmentalize what I'm doing and why. So this first one I like to call emergencies. These are 24/7 resources. These are situations where you're going to seek help immediately. Do not pass go. You're going to do something about this right now. And then when you're done and the emergency has calmed, then you're going to fill out a care report for us to do some additional follow-up. So first and foremost, if there's a life-threatening medical emergency, we're going to call 911. A way to think about this is who can help you the most, right? Calling care team to perform CPR is not going to do anybody good. Trust me. Okay. You want to get the professionals here. So medical emergencies, imminent threat self, we're going to call 911. We're going to let the pros come in. If on another kind of level, if someone has expressed threats of violence to themselves or others, there's something like imminent, like someone's like, I have a gun and I want to kill my roommate, we're going to call UPD. We're going to get the police involved. Or we also have, there's not a ton of information out there, but we do also have a threat assessment team, right? And so if there's ever a threat, we're going to make sure that team is looking at this threat and making appropriate calls and assessments to mitigate safety concerns. So an example would be if a student says, I hate this class, I'm going to bomb it so I don't have to go anymore. This is not a situation where you sit on this and say, maybe I'll mention something to my supervisor like next time I meet with them. This is the situation where we're going to do something and we need to have someone who can assess the risk level, do something about it immediately. Okay.
Hey, Allison.
Yes.
There's a question that came through. Gina, if you want to unmute yourself and ask your question, please feel free to. Or if you want to use the chat feature, you can send it in the chat.
It actually wasn't a question, it was a comment. Can I just make a comment?
Or of course.
When you were talking about calling the center, I just wanted to say like that seems like it would be, I don't know, awkward or overstepping, but this actually happened to me a few years ago. I had a student that he was in my class, and he just went from an amazing, talkative, outgoing student, missing class, totally changed the way he looked, dressed. And when I called him in my office, and he had broken up with his girlfriend, said he was actually thinking about hurting himself, I did call the Cruise Center with him there. And it was, a decision that I'm so glad that I did, because years later, and even to this day, this probably was about 8 years ago, he sends me a text about once a year saying that intervention, putting him in touch with the counselor at the Cruise Center, to which then he told his mom and he got long-term help, saved his life because he was going to go home and kill himself. So I just wanted to say that for anyone that might be apprehensive about taking it that far, that is the only validation I need to know that if I need to intervene, I will always intervene.
I appreciate you sharing that. And I think that's so true. Like, I think it can be really, it feels like awkward and uncomfortable to be like, hey, let's call the counseling center, right? But what happens is like you're coming from a place of concern and a place of empathy. And so what you're communicating to the student is like, I appreciate what you shared with me and I'm recognizing you're not okay and I want you to get help and I want to help you get help. Like we have a lot of folks, I know we're in the Evansville campus, but we've had a lot of like folks, especially from engineering, that will walk students like over to our center too. And so I've never experienced, whether it's like faculty, staff, or other students who are calling about a friend that they were concerned about or another student that they were concerned about. I've never experienced that person actually getting mad at them for calling. They're actually really grateful because a lot of times, like I mentioned that perfectionism piece. And so a lot of times what students will kind of share with me and like our other counselors is that they feel like that their concerns aren't really like a big deal, right? And they kind of push things aside and they're like, well, somebody else can get help. Like, I don't need it. It's not that bad for me, but it really is that bad, right? And so if you're helping them to be that link and getting them that connected to that resource that maybe they've been wanting to do for months and they just haven't done it, it's really instrumental.
And that's really a warm handoff, right? So, I can sit here and say the Cruise phone number is blah, 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 right? But calling, saying, hey, I'm going to help you get connected. Like, let's call together. That tells you like two things. One, that they got connected and that you supported it, because once they go into career center, right, you don't know, right, because of their privacy and confidentiality. And then it shows that person that you care enough to see it through. And so that does wonders for your relationships too. So thank you so much for sharing that story. I think it's a wonderful illustration of how this can be really helpful. And just like Morgan shared, I don't think I've ever had someone be like, no, don't call career. No, I hate you for suggesting this. Like, not even suggesting it, but doing it, like, even. So I think sometimes helping them take that first step is really instrumental, because they're going to be okay with a house on fire. They already have been, right? So how can we get them out of the house? All right, so the next one, I like to call this one activate the experts. We're really fortunate to have big units here with the Career Center Title IX. So whenever there is an issue in one of these realms, we can absolutely rely on our colleagues in these units to help support our students. So if a student is exhibiting unhealthy psychological behavior, if they're expressing any suicidal thoughts, or if they're just interested in counseling, let them go to the counseling center, right? Before, some people had the misconception that you need to put in a care report to get them to the counseling center. That's not the case at all. That just creates a barrier and an extra step for them getting help, right? So if you're meeting with a student, they're saying, yes, I'm struggling with XYZ. Yeah, actually, counseling does sound like it'd be really helpful for me. There's no reason for care to be involved, right? This is something where we can just get them to the Career Center. You can schedule them. I'm sorry, this slide is like a little bit out of date with the hours and whatnot. But you can schedule them with phone or online, get them connected to a career.
And they can just walk in, so if they need an appointment in that moment too, they can just walk into the center
Yes.
for emergencies.
Yep, if it's an urgent concern, they can still come in. Next, if a student is allegedly involved in a Title IX reportable situation, they can go to Title IX. You can report some Title IX stuff on the CARE website, and that's just because we want to make sure nothing gets missed. But we are absolutely not a step in that process either. You can go straight to Title IX. And on the back end, we do provide support a lot of times to alleged victims and alleged perpetrators of Title IX situations. If you're not aware, they also have a hotline, and this hotline is anonymous. So if a student wants to weigh their options or understand what it looks like going through the Title IX process on campus or within the legal system, this hotline is an excellent resource that can help them understand what those options may be without putting something into motion, essentially. So an example would be, you're in an advising appointment and a student mentions to you that they have thoughts of suicide. You can, at that point, do what we have been talking about with that referral and getting Caruth on the phone and getting them connected to an appointment. Ideally, if you can walk them over, that would be a great opportunity to do that, or PRT over. And then lastly, this one is a little bit different, and that's because we have a lot of different academic departments, and our university really supports all of our different units doing what works best for them. So situations in this category, we'd like to say follow procedures, and we recognize that that might be different depending on what unit you're affiliated with. So an example would be if a student's being disruptive in the classroom setting, you can absolutely always report that to student conduct. I think documenting it is really important so that we can address behavior before it escalates. You may be able to handle that within your own academic unit. You might have your own process there. And so if you have that, you should follow that process. And then of course you can always refer to CARE, and we work collaboratively with the Office of Student Conduct to address behavioral concerns as well. None of these units I just talked about are 24/7. So submit a CARE referral. I think a lot of people on this call are probably familiar with a little bit with what we do. So this is our website, and on our website is our report form. It's important to know it's not monitored 24/7. It's not emergencies. Like I said before, you do not want me to be called when CPR needs to be performed. I think I've been trained, but like I'm not the best person for it, right? You want to take care of those emergencies first and then follow up with CARE. So university, police, or the Career Center is going to be your point of contact for those emergencies in the moment. A lot of people are having questions about, well, I don't know if this is a CARE report form or not, or hey, something happened after I submitted a CARE report, so I have to fill out another one. No, you don't. You can just call or email me and I'll do it for you. You don't have to fill it all the way out again. If you have any questions or concerns, please feel free to contact me. And if I can save you writing a CARE report, I will every single time, I promise you. So we do have quite a bit of overlap. Caruth and CARE, we do a lot of presentations together. We have a lot of overlap with our students and their concerns. So it's important to note what might be different for referrals. So the Career Center can provide support in the immediate moment. Like I said, they're 24/7. They've got a great staff. Whereas Care Team, we are not emergency resource. We will review the referral, and then we meet with our team and we determine what action to take. Career Center can talk to the student if they're present with you. Typically, they don't cold call students. Whereas Care Team, that's what we do essentially. And the really cool thing is that because we have a multidisciplinary team, that means we have many different options of doing an intervention with a student. So it's not always that a student, has an intervention where it's known to them that it's a member of the care team or an extension of the care team. It's not always like, hi, I'm Care, and we're going to sit here and talk about this right now. We're kind of sneaky, and it's good because we're able to get things done a little bit differently sometimes. So there are going to be flexible interventions. It's not always going to be myself that reaches out to students, although I do quite a bit of those. We are not counseling. We do case management and care, whereas the counseling center is counseling, of course. And then we're mandated Title IX reporters, whereas the Career Center is confidential. For those of you on the branch campuses, there are care teams on every single campus. And then the chairs of those teams are the dean of students. And then I have links to their websites, but our report form is one and the same. So our same report form can go for everyone. And so now we're going to open it up to questions. Where are we on time? We did it in an hour. I'm very proud of us. Are any observations too? I'd love to hear what you all are seeing that we might not see just yet.
I do have a question. This is Lori.
Sure, go ahead, Lori.
I'm in the forensic science program, and I've referred quite a few students over the years to Caruth and Care Team in different departments there. One of the things that my students are worried about is when they go to do internships or jobs, they're going to usually be with a federal or state agency, and they get extensive background checks done, and they're worried about mental health issues showing up in a background check.
So that's a good question, Lori. This is Morgan from
Why don't you-
Caruth. So,
Be close to the mic.
yeah, sorry. So that is something that does come up. So we have a lot of students with forensics majors, engineering majors who are working for the government. And so what will happen is when they apply for the positions, they'll of course go over the paperwork. And one of the things that the students do sign is a consent to relate, for that, whatever whoever's doing the investigation, to obtain information about their mental health records. And so we do get those requests. The form is actually typically what it usually asks is, when was the person seen there? How long were they seen for? What is their diagnosis? And then it asks, do we have a concern? Oh, I think it's do you have a concern that they cannot, it's something about trusting the country or something, serving the country and trusting the country, something like that. So it's really brief. We don't share full records. Most of the times, they're seen with a trainee or somebody who isn't even here before. So we don't even put diagnosis, that kind of stuff. But when they do apply for jobs, it would be something, when they go through the interview process, it is something that they would be reviewed with, whatever governmental staff, and they would have to sign that release, and that does come to us. And then usually it's an investigator physically comes to the center, and then they stand over us while we fill it out. So that's a good question. So it is something that does come up, but I would encourage them not to have that impact, their ability to access care, unless they're going for a highest level of security clearance. I've never had somebody where we've had to provide all records. It's just usually a form with a couple check boxes.
Okay, I talk to background investigators a lot, so
Yeah.
Since I'm the upper level advisor, I usually talk to everybody.
Yeah.
that comes in and is getting a background check done. But I've had several students that say, well, I don't know if I want to
Mhm.
go to Caruth because that might hinder me.
Yep, it would be
So,
the same if they went somewhere, if they went to another therapist somewhere else, it would be the same thing.
yeah.
So, yeah,
Okay. Thank you.
yeah, you're welcome.
It doesn't look like we have any other questions in the chat right now. So Kayla, I would say, thank you, Morgan and Allison, for coming and talking with us, for the information you provided. But now we're going to turn it over to Kayla to do some surprise information for everyone.
Can I still have a jump drive?
Yes.
And so because Caruth we changed our name, we don't have any fancy handouts, so I'm gonna email Jens, the ones that we have just created to like print off. I'll need to exit out of it. Okay, I think I exited out of it. Did I?
Yeah, I think you're out.
Why? I know. Okay, I don't know. I'm just gonna. I've never actually. Well, never.
Yeah.
All right, well, thanks again to Allison and Morgan and the rest of the team over at Caruth and Care. So real quick before we kind of do our informal networking, if you're in person, I just wanted to make a couple quick announcements on behalf of the School of Medicine. So I'm going to do in our undergraduate and professional programs capacity. So I was just going to screen share really quick. We are working on a more centralized major change process. So this is, a little different from how things have been done in the past. So if you are working with students, and I know this time of year, you probably have a lot of students that you're seeing for advising. I know we are too, up at the Health Sciences Center. So if you have a student that would like to change to one of our professional or undergraduate programs, this is kind of just a quick chart, and I'll send this information to Jen to have her send it out to the listserv as well. But so our programs that are housed under our umbrella for undergraduate students right now are communication sciences and disorders. So this is new for this fall. They were previously housed in education and human services. They're now being housed in the School of Medicine. So if you have students that want to go the route of speech pathology or audiology as a grad program, communication sciences and disorders is our undergraduate major. That's great, for applying to those programs. The minimum GPA to apply to communication sciences and disorders or to change your major to CSAD is a 3.0 GPA. If you have a student that's interested in exercise physiology, so this is going to be a lot of pre-med students, PT, OT, dental school, all different types of healthcare careers. Their minimum GPA is a 2.75. Health informatics and information management is a 2.0 GPA. That program is also offered high flex. So I think that's important to mention if you have students that maybe are looking for something that doesn't require them to be on campus. Immunology and medical microbiology, this has a 3.0 GPA requirement. They also need to have successfully completed biology 115 and chemistry 115 with a C or better in order to change into this major. And they also need to understand that this major does require math 150. So that is just a the math requirement, chemistry prereqs to join our IM and B major. For biomedical laboratory diagnostics, have your interested students contact me directly. This one is a little bit different because there are a few different avenues into this program. It really is a true program where you have 2 years of undergraduate coursework and then two years of laboratory work at the undergraduate level. So they really start the BLD laboratory coursework in their junior year. In order to be accepted into BLD, you have to make sure you have all of your prereqs. So that's why they can just contact directly, and we can talk more about how to be successful to change into that major. If you have students that just have general questions about our majors at the health sciences, in the school of medicine, undergraduate and professional programs, I'm going to be the point of contact for those going forward. So just, they can email me. I'm just kayla.polling@hsc.wvu.edu. And my phone number is 304-293-0441. And I'm happy if your student's not sure if they meet the prereqs or they want to talk about timeline to completion, if it's a good idea to switch into a major, I'm happy to talk to them about that. We've also recently launched a series of major change websites within the School of Medicine. So each of our majors has its own website now with more information about the requirements, outcomes, and things like that for changing your major. It also will give them the process on how to change their major. But we're just really excited to kind of do a more centralized major change process in undergraduate and professional programs. So if you have any questions, I'm happy to try to answer those in the question box. Also, one note with exercise physiology, there's no longer a mandatory major change session. That information can be found on the website, and we're going to do those more on one-on-one meetings with the students. If you do have any students that maybe you're talking to this afternoon, we do have a major change. There's an information session about our major this evening. So if you have students that might be interested in the exercise physiology major, they're welcome to join us for that tonight at 6 o'clock out at the Health Sciences Center. But if they're unable to make it, feel free to connect them with me, and I'm happy to help them become a member of one of our majors. Freddie.
Will you be sharing this information out with the AAC?
Yes, I will be sharing this out with the AAC.
Thank you.
You're welcome. Any other questions? Do we have any chat questions?
No questions for Jen.
Okay. All right, well, that is all that I have. So like I said, I'll get this information out to Jen so that way we can share it out with everybody. Okay, so I'll just go ahead. Thanks everybody that attended virtually and in person. We're really excited, that you were able to join us today, and our next meeting will be in October, and we'll be back on the Evansdale campus, and you'll be receiving more information about the topic and how to sign up for that workshop in the coming weeks. So have a good rest of your day, everybody.
Good to see you, Kayla. Do you miss us?
You too, Gina. Do you like my mask? I feel like it's very Gina.
It is. I love that leopard print.
Yeah, it's a rainbow leopard mask. Thought I went with my orange shirt today.
I love it.
All right. Well, I'm gonna go ahead and just end the meeting, Freddie.
Yeah.
Do I have to stop record or?
Nope, it will.
Okay, just end.
Yep.
Okay.